Hi, this is Dr. Ram here from MedManners. So I'm going to draw the basal ganglia circuits in a very simple way. So let's do it. And now this is the cortex and this is the striatum. That is, you have your caudate and putamen are represented as a single structure here. And this is your globus pallidus externus and this is your internus. And here comes your thalamus. And below the thalamus you have subthalamic nucleus. And this is your substantia nigra. A black structure will be seen in the midbrain region. So now we have so many neurons connected between these structures. They are broadly classified into two. One is the direct pathway, the other is the indirect pathway. The direct pathway, which means the cortex will be connected to the striatum with a neuron, and from the striatum to the globus pallidus internus, and from the internus to the thalamus, and from the thalamus again back to the cortex. So it is more straight pathway, a direct pathway. So the indirect pathway, so from the cortex to the striatum, from the striatum to the globus pallidus externus, from the externus to the subthalamic nucleus. Note that, subthalamic nucleus, and from the subthalamic nucleus to the globus pallidus internus, and from the internus to the thalamus, from the thalamus again back to the cortex. So now some neurons are excitatory and some neurons are inhibitory. Remember this point. The neuron that comes out of a cortex are going to be a stimulatory, that is, it going to release glutamate. So this is a stimulatory neuron. This is a stimulatory neuron. The neuron that comes out from the thalamus are again going to be a stimulatory neuron. So this is a stimulatory neuron. This is a stimulatory neuron, which means it releases glutamate in the cortex here. So these neurons releases glutamate in the striatum here. Clear? Okay, one more important point. The neuron that comes out from the subthalamic nucleus are also going to be a stimulatory neuron. That is releasing glutamate in the globus pallidus internus. Now, all the connections in and out of a basal ganglia are going to be a inhibitory one, which means it is going to release GABA. Inhibitory, 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 inhibitory. And this is also inhibitory. Okay, once you understand this pathway is going to be very easy. Okay, now how does the direct and indirect pathway works? When you follow these pathways, you will understand it very easily. For example, so this neuron releasing glutamate here, stimulating the GABA releasing neuron here. So this releases GABA in the internus. So this neuron is inhibited. So this neuron is inhibited. This neuron is inhibited. So when this neuron is inhibited, there is a decrease in the GABA secretion here. So this neuron is excited and releases glutamate in the cortex. Clear? So this is the direct pathway which increases your movement. And now what about the indirect pathway? So this neuron releases glutamate here. It excites this neuron. This releases GABA here. So this neuron is inhibited. This neuron is inhibited. So there is decreased secretion of GABA here. So when there is decreased secretion of GABA here, this neuron releases lot of glutamate in the globus pallidus internus. So exciting this GABA secreting neuron. So this GABA secretion is increased here so that this glutamate secreting neuron is inhibited. You just pause this video and revise it with this picture and you will get it definitely. So the output from the cortex are going to be a stimulatory neurons stimulating the neurons in the striatum. Okay, all the connections in the basal ganglia are going to be an inhibitory one. So the output from the thalamus are going to be stimulatory and output from the subthalamic nucleus are going to be stimulatory. So the direct pathway always increases the movement. The indirect pathway always decreases the movements. And now, what is the role of substantia nigra here? In order to understand this, you must know that the neurons that comes out from the substantia nigra goes to the striatum. So it goes to the striatum like this. So these neurons are secreting dopamine. Very important. Take it down. So dopamine. So it releases dopamine. So what is the receptor that the dopamine is going to act on? So the dopamine acts on two types of receptors. It can be a D1 or D2. So in the direct pathway you have D1 receptor, and in the indirect pathway you have D2 receptor. Why is this important? Because D1 and D2 are both different type of receptor. Exactly the opposite. The D1 receptor are stimulatory. We'll learn in the second messenger systems about GS or GI. By now you just remember D1 receptors are stimulatory and D2 receptors are inhibitory. So this is GI. So what happens if dopamine acts on D1? It is going to stimulate. And dopamine acts on D2 receptor. This is going to inhibit the indirect pathway. So the neurons from the substantia nigra acting on D1 and D2, what is the effect here? So it stimulates the D1. So it increases the movement. That is, it stimulates the direct pathway, increasing the movement. And it inhibits the inhibitory pathway. Therefore, it increases the overall movement by stimulating the direct pathway and inhibiting the indirect pathway. It increases the overall movement. So in Parkinson's disease, there is a great destruction of these dopaminergic neurons. So there will be great disturbance in their normal movements. I hope this picture is very clear in your mind now. You just take a piece of paper and try to draw it with yourself and you'll definitely get it. See you with more interesting videos. Bye from Dr. Ram.